I love that movie. Now, Dr. Z is here. She's here to talk about another topic, but you've actually been to Sturgis.
Yes, it's a wild place.
Did you, I have to ask this, you know, one of the traditions in yesteryear was women flashed. How did you behave at Sturgis?
I misbehaved.
You misbehaved.
That was a few years back, but I misbehaved.
And you misbehaved. Okay, enough. Anne, would you misbehave if you were at Sturgis? No, okay.
No, I'm here for straw poll results, Geraldo.
Okay, so let me go from bikes to breasts. If you're thinking of having breast enhancement surgery, and incidentally, we're monitoring the events in Ames, Iowa, and the second the straw poll results are beginning, we'll flash there live. But you should know, if you really are considering a boob job, a new report says that women who receive implants are 3 times more likely to commit suicide, and that deaths related to mental disorders, including alcohol or drug abuse, are also 3 times higher in women who have had breast enhancement than in other women. So is there a link between suicide and breast implants? We're joined from Boston by Heather Elizabeth, who survived cancer and has had implants and subsequently posed for Penthouse magazine. And of course, here our resident clinical psychologist, Dr. Victoria Zdrok, is also with us. But Elizabeth, would you see a connection between, I mean, has it done anything to your head? Do you buy this study?
The study in particular, I think,
Heather, I'm sorry,
is a little, that's okay, it's a little misleading, because I feel as though the women who get the breast implants that do commit suicide later down the line, it has more to do with things that are going on internally with them, whether it be body image or their self-esteem problems, and I feel as though they think getting breasts could take care of that. In turn, getting something physical done on the outside doesn't take care of the inside, and that is actually what I think is happening with these women.
Heather, stand by a second. You know, that sounds logical to me.
Oh, absolutely. You know, and the important thing to realize is that correlation doesn't imply causation. It doesn't mean that breast implants cause depression, suicide. There's usually another variable. In this case, it's usually body dysmorphia or another psychopathology that is not screened for. So these women, a lot of them probably have preoccupation with their bodies, unhealthy preoccupation, which you know, no amount of plastic surgery can resolve.
So it's as Heather says, it's the problem you had going into the breast enhancement. So Heather, how are you doing now?
Oh, I'm doing great, actually.
Well,
I'm at a wonderful point in my life.
Yeah, tell me how. What?
Well, I mean, I went through chemotherapy 3 different times, battling cervical cancer, from when I was 17 to when I was 23. After the last bout, I decided that I would get breast augmentation because I did not feel like a woman after the chemotherapy. It had completely gotten rid of my body fat, my breast tissue more in particular, and I wanted to feel more like a woman. I was a model at that point, and there were different different opportunities that I wanted to get to. Having the breast implant surgery has been amazing for my life. I've never felt better. I have, taken my career to a different level by posing for Penthouse in the August issue for this year, and it just made me feel healthier and more like a woman, and I think it's, one of the greatest things I've done for myself.
Well, stay healthy, and thank you very much, Heather, for being in. Dr. Z, thank you also. When we come back, a former child star comments on